talked about the sleeper cells and that lefty, which is found in embryonic cells, but it's not found in fetal cells anymore. So, in fetal cells, they are more organ-specific already. They are also very potent cells, but they are organ-specific. So that's why we use most of the growth factors from early fetal cells, because they are very active and they already know what they are supposed to be. Liver cells, heart cells, brain cells, nerve cells, whatever. And if we do that, we can really adjust and make a fine-tuning actually of any kind of tumor treatment. Those dormant cells, they can be marked. Okay, that's one thing. But you cannot. It would be too big of a mass of embryonic cells to put in a body you can be sure that all dormant cells can be found, because in some niches they can also find some. They can stay for 5, 10, 15 years in early onset cancers where they very aggressive they had their very aggressive treatments. They have secondary cancers after 15 or even 20 years. So in that case, we have to keep up. We have to keep up the immune system as high as possible, and to activate the detox system, the liver system, then also the metabolic possibilities, detox of the intestine from the gut, because there we have a lot of toxins coming in, what we actually should get out. So to keep that up, we have to have also a follow-up, and we have a lot of cancer patients who come who are, first of all, they were treated and they are fine. And in school medicine, when I don't see anything anymore, I say, well, you're fit, you can go home, live as you lived ever. But if you lived as ever, that was the situation where the body allowed the cancer to grow. So that's why we always try to stress, have a follow-up, and look after a while, let's say 3 months, half a year, or sometimes they come after 1 or 2 years back, and we look how is the organ system working, how is the immune system working, and then we have sometimes a follow-up also in treatment that you can keep up and with the best possibilities the body can have to reject any kind of sleeper cells if they wake up. And we have that. It's the same regime in chronic virus diseases, because also a lot of those chronic virus diseases are you have, first of all, a heavy or a slight virus disease, and a lot of the viruses are thrown out by your immune system, but a part of it goes into the cells. The same problem with Lyme's disease. They go into the cells, and then from there they can have their winter sleep for 1 year, 2 years, or whatever, or they can come out always a little bit and nag on your immune system. And that's why we always also try to keep up the immune system, that as soon as those viruses or bacteria come out of the cells, they are recognized, caught, and we cut down on the number slowly but surely. So that's actually the healing process. The other treatments are just they try to get you not sick, not healthy but not sick. So we try to get the person healthy. So it's a healing process. Which takes sometimes longer, or quite a bit, and the patient has to be responsible with his own body, with his environment, with what he's doing. But it's the only possibility. Symptomatic treatment is, in the long run, nothing. That's why the pharmaceutical companies, and I don't want to say anything about it or against it, but the money they make is going better. And on the stock market, they rise quite a bit.